To the Minister of Health. Speaker, in 2007, the McGuinty government converted the Ontario Air Ambulance and Critical Care Land Ambulance Service to a not-for-profit corporation. As has been the practice of this government, that was done without a competitive process. Since that time, the cost of providing air ambulance services in this province has increased by more than 450%. Can the minister tell us why costs have been allowed to get out of hand through this organization, and why have the appropriate accountability measures not been put in place?
Minister.
Speaker, I welcome the question, and I do have to say that I think it's very important that when people need health care and they need to be transported by helicopter or by plane to get that care, we need to be there to get them the care they need as quickly as possible, Speaker. I would hope that the member opposite is not suggesting that we actually cut air ambulance services, Speaker. We do know that the party is determined to cut health care. I hope this is not a signal, Speaker, that air ambulance is what they are planning to cut.
Commentary.
Speaker, the minister came awfully close but didn't go quite as far as the Premier chooses to do in this place, and that is to absolutely and grossly misrepresent and tell.
Ask the honourable member to withdraw the comment he's just made.
Withdraw that. The fact is the Premier insists on speaking untruths about the intention.
Withdraw the comment, please.
I will withdraw the comment and get back to the questions. The reality is, Speaker, we want to ensure that all of those essential emergency services through air ambulance are delivered in the most efficient and reliable and accountable way. Will the minister agree to call on the Auditor General to conduct a value audit on this organization to ensure that, in fact, we are getting our money's worth?
Minister.
You know, Speaker, I just have to say, it is still a mystery as to what exactly their plan is. They are not actually wanting to tell us what the plan is, but what we do know for sure, Speaker, is that that is the party that wants to cut taxes. Whether they cut $3 billion from the HST or $6 billion from the HST or $3 billion from the health premium, we know, Speaker, on this side of the House, you cannot cut taxes, fight the deficit without cutting services. We also know, Speaker, that health care takes up almost half the spending in this province, and you cannot cut $3 or $6 or $9 or whatever the number is, $billion, without cutting health care services, Speaker. It is completely disingenuous to suggest that you can fight the deficit, cut taxes, and improve services, Speaker. So as long as that's their plan, we will call them on it.